Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hey listeners, it's Lindsay Smith Rogers. Today, navigating the changes in vaccine policy at the federal and state levels. I'm joined by Northe Saunders, President, and Jennifer Herricks, Advocacy Director for American Families for Vaccines. We talk about what's been happening with vaccine policy at the federal and state levels and how voters play a key role in the process. Just a note that this episode was recorded prior to a decision by a federal judge to stay Robert F. Kennedy Jr.'s vaccine policy changes. Let's listen. Northe Saunders and Jennifer Herricks, thank you so much for joining us on Public Health on Call. Today, we're talking about Families for Vaccines and just trying to navigate some of the many changes that have been happening over the last year or so. But to start off, I'd like for you to introduce yourselves and talk a little bit about your work. So let's start with you, Northe.
Great. And thanks so much, Lindsay, for having us on the podcast. We're really excited to talk about this issue. My name is Northe Saunders. I'm the president of American Families for Vaccines. I'm based in Portland, Maine. I'm the father to 3 school-aged children, and I'm married to a pediatrician. At my root, I'm a political advocate working to make sure that our kids are safe in schools.
And Jen?
Thanks so much, Lindsay. I'm Jen Herricks. I am the Advocacy Director for American Families for Vaccines and also the founder of Louisiana Families for Vaccines. So I am based in Mandeville, Louisiana. I'm the mom of 3 young kids, and I also am trained as a microbiologist and have experience working in global health policy as well.
And so, Northe, would you just give us a basic overview of what Families for Vaccines does?
Yeah. And so what our real goal is to empower everyday people to stand on the shoulders of experts, pediatricians, providers, and make sure that their voices, the voices of the pro-vaccine majority, are heard inside state houses, that lawmakers understand there's a pro-vaccine majority in every single state of the country, and that our organization is here to support by recruiting them, training them, and then giving them the resources to make sure we continue to have strong vaccine laws all across the country.
Thank you. And so, Jen, why don't you kind of walk us into where the landscape is right now? There's been a lot of changes at the federal level. Can you give us an overview?
Yeah. So in the past year, we've seen some major changes at the federal level in terms of how vaccine policy is made at that level. So the big thing that happened is the ACIP, this committee that is the Advisory Committee on Immunization Practices. They are responsible for reviewing data related to new vaccines, existing vaccines, and making sure that the recommendations for the country as a whole are based in the best science that we have available. That committee was completely dismantled by the Secretary of HHS, RFK Jr., who fired all 17 members at once and then replaced the entire committee in very short order, mostly with people who ideologically agree with his anti-vaccine stance. And so, as we have expected, we've seen changes happening pretty quickly coming from that committee, including removing a lot of vaccines from their previous universal recommendation for all children into something called shared clinical decision-making. And I know we'll get into this a little later in the podcast, but that has injected a lot of confusion around who should be getting which vaccines. And we know that this type of confusion will lead to lower immunization rates. But the biggest concern, I think, from our view is that these changes were made without any new scientific evidence to support those changes.
What does ACIP kind of have governance over versus what's happening at the state level? So, Northe, would you walk us through what that looks like?
Yeah, so I think there's a pretty big difference in terms of the federal government does and what happens at the state level. And so the Advisory Committee on Immunization Practices is exactly that. They're an advisory committee. They are supposed to look at scientific evidence. They're supposed to advise a CDC director that then makes recommendations on what vaccines families and individuals should get. The federal government also has the power of the purse. And so a lot of vaccine funding comes from the federal government through the Vaccines for Children program. At the state level, they're responsible for implementing vaccine policy. And so the funding and the recommendations start at the federal government. At the state level, we see vaccine requirements for schools, healthcare settings, funding being distributed to local health departments for education and access and administration. And so really a lot of the vaccine policy work happens at the state level. And that's why our organization, even though we're American Families for Vaccines and we work nationally, the real work that we do is at the state level to educate lawmakers, bring advocates to the Capitol, and show that the pro-vaccine majority is here to continue to have strong state vaccine policy.
I think it would be helpful to walk through, examples of this legislation. So, Jen, let's start with you.
Yeah, I think the most extreme version of this legislation that we're seeing are these medical freedom bills. They can be very, very broad, but one of the things that they almost always do is to get rid of vaccine requirements and prohibit any future vaccine requirements. So some pretty dangerous legislation. These can be statewide, school-specific, employers, sometimes even healthcare facilities are rolled into these types of medical freedom bills. And the language sounds really good, right? I mean, who can be against freedom? And so I think that that's definitely a tactic that they're using. But really what this is creating, or would create if a bill like this were to pass, is the freedom of the diseases to spread, especially amongst vulnerable communities. Sometimes we see these types of bills focused on just a certain vaccine or a set of vaccines, but these are still really, really dangerous because, first of all, it sends a message that these vaccines are no longer important to protect our kids. And when we see this at a policy level, I think a lot of people just assume that if it's in policy, then it must be based on hard evidence, when in this case, that is not the case. But they're also dangerous because simple amendments could make these bills apply to all vaccines broadly. And in the most extreme versions of these bills, we've actually seen versions that would change the state constitutions to prohibit vaccine requirements.
Medical freedom bills are really increasing in popularity. How do you think about the medical freedom mentality in your messaging?
When we think about medical freedom and the choices to make those medical decisions for our families, none of the policies that we're talking about in terms of the policies that we promote as being good vaccine policies take choices away, right? They make it possible for more people to participate in public life. But where we do have vaccine requirements are typically places where there are vulnerable people like children or, patients, and then places where diseases are likely to spread and cause outbreaks. And so those policies are in place to protect those populations, but it doesn't mean you have to choose them, right? For families who have true, can't be vaccinated, there are medical exemptions that exist, and these policies protect those people as well. These policies are put in place to protect people when they are the most vulnerable, to make sure that we can all stay safe.
One thing I have heard of was there were moves to actually criminalize clinicians that were giving vaccines. Are you still seeing that?
This legislative session, and legislative sessions generally run January through June in most states across the country. We're not necessarily seeing that type of legislation. We've seen it previously. And it might be useful just to back up a little bit and talk about trends in state vaccine policy, right? We're really concerned about what's happening at ACIP right now, but there has been an anti-vaccine movement at the state level for a long time, and the number of bills that have been introduced pre-pandemic, where typically we saw 100 to 200 bills introduced across the country, that number really spiked in 2022 to over 1,500 bills introduced, mostly in response to pandemic response. There was a decline in 2023. We saw about 1,000 bills introduced. In 2024, around 500. But with the incoming administration and the bully pulpit that RFK gained in 2025, that number was back over 1,000. And right now we're tracking nearly 600 pieces of legislation. I think the good news is that the divide, and you asked about criminalizing clinicians and their actions, we're not necessarily seeing that pointed of an attack. The bills are more broad, like Jen was speaking about, for medical freedom. But the great news is that there's a lot of states working to shore up vaccine access and protections. Unfortunately, it's a pretty red state, blue state divide. The red states are looking to emulate the federal government in their recommendations, whereas the blue states are looking to ensure access, funding, and that the families that want to get immunized, they can do that. And we're seeing that in the Northeast and the West Coast. They have these collaboratives or alliances where states are banding together to help shore up recommendations. We're also seeing trends in legislation around changing where states look for recommendations. And so rather than looking to ACIP and having the ACIP referenced in statute or code, we're seeing states move to look at recommendations from the American Academy of Pediatrics, the American Academy of Family Physicians, or the American College of Obstetricians and Gynecologists, ACOG. And so we're seeing this move in those blue states to look at recommendations from those trusted bodies, which we think is good, particularly with the recommendations that are coming out of the federal government.
And Northe, can you just clarify, when you say that there are, 600 some odd pieces of legislation, is that all anti-vaccine bills? Does that include some pro-vaccine as well?
It does include pro-vaccine. And I think historically, and I don't have the numbers in front of me right now, but it was kind of like 10 to 1. The divide here is much more even this legislative session. And so right now we're tracking 276 bills that we support, and we're opposing 346. And so just, a little shy of that 600 total number. Lawmakers in the states where they have politically favorable environments are really stepping up and taking action to protect that access, protect that funding, and make sure that families can still get immunized if they want to. And I think a great example of that change that happened after the ACIP looked at COVID vaccine recommendations and caused a lot of access problems. We heard anecdotally from lawmakers that parents who wanted to vaccinate their kids against COVID, they were calling their lawmakers and they were speaking up saying, look, we want to make sure that this access is preserved. And maybe we can go there next, but kind of talk about the political environment versus the funding environment.
What kinds of legislation, if any, have you seen to shore up access for families who do want vaccines? I mean, I'm thinking particularly funding-wise.
I think it's important to understand that a lot of the funding for vaccines, particularly vaccines for kids, comes from the federal government. And I think the kind of erosion of the federal policy landscape is having knock-on effects at the state level. And so we are hearing anecdotally with changes to recommendations that parents feel like they'll have less access to vaccines. I do think that it's kind of hard to find an example of a less favorable policy environment where they're actually tackling these hard questions, that there are states taking swift action to protect access and funding, but those are not the states that are unfriendly to vaccines. And so the policy fights are really about expanding exemptions, removing requirements, and not really even thinking about what the long-term effects to access is going to be. And it's unfortunate, but I think we're going to feel the effects of this for a long time, whether it be from a funding or a policy perspective.
You've mentioned, we want lawmakers to know that the majority is showing up and asking for this access. So can you tell us what you know about what Americans want right now?
Yeah, and so we've conducted polling in 5 states and are about to field polls in a few other states. And these are both in red states and blue states. And the overwhelming response is that in a bipartisan manner, Americans want to keep school vaccine requirements the way they are. They don't want to expand exemptions. And in fact, vaccine exemptions for school entry are unpopular, even in deep red states. And so our role is to take that majority and demonstrate it to lawmakers through polling and other methods that this is a politically unpopular movement. And I think we're seeing a little bit of that from the federal level. The White House is retreating a little bit on their aggressive anti-vaccine stance. And we're seeing lawmakers in states like New Hampshire actually defeat some of the worst legislation. New Hampshire had a House Bill 1811 where it would remove all school vaccine requirements. And that was defeated in a fairly spectacular manner on the House floor. And so I see a lot of hope that as more Americans learn that vaccine access is being threatened, they're responding to the polling questions in the way we know they generally would. And then lawmakers are not actually advancing the worst pieces of legislation. Each state is different. Each state has its own political considerations. So maybe I'll pass it to Jen. She can talk about, each state has its own unique environment. So challenges are different.
Yeah. And actually, what I wanted to add to that, in New Hampshire specifically, what we heard was that lawmakers were hearing from constituents on that bill and, like they never have before on other issues. And it really speaks to it doesn't matter how you identify politically. The majority of people don't want to see the continued spread of measles. In the news recently was the case of the child who has encephalitis. And we're going to see more and more complications like that if these diseases continue to spread. No matter your political affiliation, we don't want to see polio come back and diseases like diphtheria. And, there's no memory for most of us of what that is because we've never had to live with it. And I think people just don't want to go backwards after we've made so much progress in the health of our children. This is an issue that I think speaks to so many people, and the polling that we've done has just reaffirmed that for sure. Removing vaccine requirements is not a popular issue for voters.
And so, Jen, just to build on this a little bit, I think there's some confusion around things like requirements, recommendations, and then there's a lot of confusion about where this language is coming from. With some of the different populations of people that you all speak to and work with, how do you help them navigate all these sort of loud messages?
Yeah, there really has been confusion on multiple different levels. I think as Northe was saying earlier, there's confusion from families. What do these changes mean for me? Does this impact me and my state? How does this impact the requirements for my kids? Should my kids be getting these vaccinations? And even sometimes providers are confused about the changes that are happening at the federal level and what does that mean about the vaccinations that they're able to give to their patients, even if they know that these vaccinations are extremely beneficial. And so, there have been a lot of the medical groups, like the American Academy of Pediatrics, ACOG, and others, are putting out their own vaccine recommendations that are based in evidence as a way to help clarify some of that. And one of the things that we've done, we've just created a new resource that we're calling the Vaccine Policy Atlas. This is just the first version. It's really focused on states where American Families for Vaccines have chapters and focusing on how the Advisory Committee on Immunization Practices impacts state laws and rules in those particular states, so that whether you're a policymaker, an advocate, or anyone else who has a vested interest in this issue, you can quickly turn to that to see how do these federal changes change what's happening in my state, and what can we do to protect vaccine access from any potential negative changes.
Just to follow on to that, like us as parents and as vaccine advocates, we are looking directly at the American Academy of Pediatrics, the American Academy of Family Physicians, the American College of Obstetricians and Gynecologists. Their recommendations are based in science. And so if a family has a question about vaccines, they should speak to their pediatrician, to their provider. They're the ones that can offer the best recommendations in this political climate. And we stand arm in arm with them against these federal changes to make sure that we get the best information possible to the people that have questions.
So just to wrap us up here, you all have been doing this work for a while. Let's start with you, Northe. Final thoughts, what do people need to know?
I think we need more people speaking up, that even if you live in a state like Maryland, lawmakers need to hear from the pro-vaccine majority. And so to the listeners of this podcast, contact your elected officials, whether it's at the state level or at the federal level. Say that you want to continue to have access to vaccines that help save lives, and that we need more people working together. The anti-vaccine movement had their biggest win last January with the appointment of RFK Jr. to the nation's highest public health office. And it's never been more important that we work together to continue to educate and advocate. And, I think there is light at the end of this dark tunnel, that we're not seeing a major erosion in vaccine policy at the state level. We're certainly having to fight really, really hard to make sure that we don't have any major losses. But I think science and medicine and reason is going to win out, because our kids' lives are on the line, and that's really what matters. And any child that dies from a preventable disease is a tragedy, and we can prevent that with vaccines.
I also wanted to just add to a little bit of, and how we do our work at the state level is that we're not coming in as American Families for Vaccines, this national organization, trying to dictate what states should do. We draw on people at the state level. All of our chapters are built and run by people on the ground. They've all been started because there are passionate advocates about this issue in that state that want to do something good to protect the children of their state and make sure that the state level vaccine policies are based in the best science and evidence available. And I think we need to see more of that. I'm just going to echo, everything that Northe said. We need more people speaking up, whether you have an existing chapter in your state and you can get involved, or if you don't, find out how to contact your state lawmakers and talk about it. Talk about it with your friends, your neighbors, your family. I think the more that we can be comfortable talking about this issue, the more we're going to find people who agree with us or people who just have genuine questions. And, that's okay too. It's, as a parent, I have questions about everything related to my kids. I want to make sure that I'm making the best possible decisions for them. And in those cases, there are some pretty fantastic resources out there, including, as Northe said, your own kid's pediatrician is probably the number one resource.
Just like to add a thank you. Like, our work wouldn't be possible without the partnership of immunization coalitions, chapters of the AAP across the country. And I want to especially thank the folks at the Johns Hopkins International Vaccine Access Center for their collaboration on the Vaccine Policy Atlas. It wouldn't have been possible without their help. And so we're really grateful for all of our collaborators, but particularly for those folks at IVAC. They've been really wonderful to work with.
Northe Saunders and Jen Herricks, thank you so much for joining us.
Thanks for having us, Lindsay.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith Rogers, Stephanie Desmond, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.